From Times Square, this is Good Morning America with Charles Gibson, Diane Sawyer.
Yeah, well, that's enough to give a person wrinkles. And if you get wrinkles, what do? You do Botox, yes? Everybody seems to be doing it. But what about extreme Botox? Well, I mean, we know that Botox is supposed to make your face look younger and it's supposed to get rid of the wrinkles. But what about Botox on your feet? What about Botox on your backside? As people bear more skin with the summer's skimpier styles, cosmetic dermatologists and plastic surgeons are getting requests to use Botox in some pretty surprising places. Dr. Paul Jared Frank, who is a cosmetic dermatologist, is here to tell us where it works and what are some of the crazy places that people now think they should use Botox, Doctor.
Well, where I'm asked is not always necessarily where it works, but some of the novel treatments that we're using Botox for now are the tip of the nose to actually turn it up quite a bit.
What do? You put it where?
You put it right underneath the tip of the nose.
And it does this?
It releases a muscle that allows it to lift up.
So you don't have to have the whole nose job?
Not necessarily. Oh, you have to do it every 6 months, though.
But what are some of the, can you tell us what some of the extreme places are?
Well, we now use Botox to inhibit sweating, and you can imagine some...
That's a good thing, but I mean, are there some wacky places you're not going to tell me?
There are certain discrete areas of the body that people have problems. The buttock area, not necessarily. It's really best for discrete areas, and it is FDA approved for certain areas only.
Okay, sweating. A lot of people sweat. Hand sweat, underarm sweat.
It's a big problem for a lot of people. It's socially debilitating. Under the arms is where it's FDA approved for now.
You can use Botox under your arms?
We actually inject it into the skin, not the muscle.
We're looking at it. Is this under the arm?
Yeah, we're doing it on the axilla or under the arm region, and we're injecting it into the skin, not the muscle. In the skin is where the sweat glands are, and where the chemical that Botox attacks is inhibited to decrease the amount of sweating.
So how long do you not sweat?
For about 4 to 6 months.
And does it hurt what you're doing? Ooh,
no, we usually do it under just topical anesthesia. It takes about 10 minutes to do in office.
You mean like a numbing cream?
Yeah,
or
just
something?
a numbing cream.
Okay. What about in your hands, where hands sweat?
You can do the hands, a very socially debilitating problem. It does hurt a bit more. We have other techniques of doing nerve blocks in the area to really make it better for the patient.
And that's okay to do that, to stop the sweating glands?
Absolutely.
Yeah?
It's really a very small percentage of the total body's sweat function, so it doesn't affect the body's thermoregulation.
Where should you not do it?
Well, you don't want to do it over too large of an area. It's still experimental, certain of its uses. I wouldn't do it in the genital area. You just want to watch the amount of Botox dose that you are giving to the patient.
Now, we hear a lot about, Botox and people who should not be doing it. I mean, you're a dermatologist. You've had a lot of experience. So if somebody's considering Botox, whether they're considering it for the wrinkles or for the sweat, what should they know? What should they do?
Well, you should certainly go to a physician who's board certified in one of the cosmetic specialties, dermatology or plastic surgery. You also want to find a doctor mostly through word of mouth, so you know the experience level of the doctor. Unfortunately, there are a lot of non-physicians and physicians outside of the specialty who are doing a lot of Botox, not necessarily with the appropriate experience.
Yeah. Is there such a thing as too much Botox?
Sure. I mean, there's an art to every form of cosmetic surgery, and there's always a good balance between getting a positive aesthetic effect and a negative one.
What about Botox for migraines?
Migraines, we're showing to see a lot of effectiveness with it. It's still experimental. It's not FDA approved yet.
That's not?
No, I have several patients.
The sweat stuff is FDA approved.
Under the arm, it's approved.
Under the arm.
But for the migraines, I have a lot of patients who were using it for wrinkles, and they found their migraines were getting better. And as with most things in medicine, they're found by accident.
So the most important thing is to find a good doctor, trust a doctor, and tell your doctor what you want. And these extreme things, are there doctors who are saying, I won't do it?
I hope so.
Yeah.
With the monetary incentive involved, unfortunately, there are people who do just about anything. But this is why it's important to screen your physician as much as a physician screens a patient.
You have no wrinkles. Do you use Botox?
I look pretty good for 60, right?
And that is the recommendation. That's the commercial today. Thank you, doctor.
Thank you.
You do look very good for 60.